Ja, herzlich willkommen bei Sunekos Deutschland auf unserem YouTube-Kanal. Mein Name ist Astrid Tomczak. Ich freue mich, dass ihr wieder reinschaut bei uns. Heute habe ich einen bereits bekannten Gast bei mir, Dr. Epps aus London.
Thank you very much.
Ja, welcome again. Und heute sprechen wir über eines der Sunekos-Produkte, was wir bisher nicht so im Fokus hatten, nämlich Sunekos Body. Wie ihr vielleicht mitbekommen habt, das Produkt gibt es schon sehr lange und es fokussiert sich auf die Behandlung von Dehnungsstreifen und erschlaffter Haut. Und wir wollen heute mal ein bisschen tiefer reinschauen, wie das Produkt genau funktioniert, was die Unterschiede sind zu den anderen Produkten, die wir uns schon angeschaut haben. Und ja, ich freue mich, dass Dr. Epps uns hier wieder zur Seite steht. So, today is Sunekos Body Day.
Sure. So this is for the areas that, to sound obvious for a second, this is typically people think body and they think anything outside the face.
Yeah.
But it's not the case because the neck is still performer, the hands are still performer.
Yeah.
It's typically the areas that are covered up by clothes. So below the décolleté, the arms, the torso, the back, and the legs. And that's where we'll come into body.
Yeah, yeah. So, how long are you using the product?
I've used the entire range for about 3 years now, roughly.
Okay. And is body or treatments on the body, is that something where you see a raising request, or is it?
Request-wise, I don't see too much, and that's because people don't know that there are treatments available.
Good, we're making the video.
Yes. And there are some phenomenal results. People who have, had children, and the skin is not as tight around the abdomen as much. I have seen patients, I think it was a case that we spoke about recently, on the back with a lot of acne and pigmentation, post-acne hyperpigmentation. All those things start to disappear. And the laxity, as well as the texture, the color, all these sorts of things happening at the same time, I think it's pretty unique. And I think for me, it's for the body, there's no other injectable that I use at all.
So what is the specifics on Sunekos Body? We have spoken about Performer, we have spoken about 1200. So every product has a, let's say, unique formulation, even if it's the same ingredients, let's say, basically. But so what is so specific with Body?
The base ingredients are no different to Performer. So you have the HA, you have the amino acids. In Performer, we can consider them like this, let's say. In Body, it's more like this.
Okay.
That's all. So we have the same amino acids in the same ratio, the same pattern, but the amount of amino acids versus the amount of hyaluronic acid is slightly different. That's all. It makes, in the ingredient list, a very small difference, a very small change. But as far as the patient is concerned, and the quality of interaction with the cellular receptors is huge and it's massive. If you were to use Performer on the body, you wouldn't really see anything.
Okay.
Or very reduced results, shall we say, at best. Whereas if you put Body in, just with that slight change, huge change straight away.
Okay, just to make sure I understood you right, so it's the ratio between the different amino acids, or it's the amount of the amino acid that has changed in the body formulation?
The total amount of amino acids and the total amount of hyaluronic acid.
Okay.
They are slightly different.
So because you need more, let's say, power for the body, for the skin, or?
You have a slightly different cellular environment in the body. In terms of the extracellular matrix. And this changes the environment in which the amino acids are being placed. And so the environment they're being placed in obviously interacts with the amino acids, but you don't want an interaction that changes the amino acids or pushes some away and not the others. You want that to be intact. There's a reason you're injecting all 6 in that ratio. So you want enough there to maintain those 6 in that ratio. And that's why we have to put slightly more in, just to keep it that way in the body. That's all.
Okay. And you have mentioned already the indications you are using a product in. So there are, I understood, 2 main indications or 2 main areas of application. So first it's the skin laxity. And second it's the striae.
You can use it for striae. There's stretch marks as well. It works very well for that. And in general, as far as the patients are concerned, if they find that a little bit too much to think about, they can just think skin quality in general. But the biggest results we see are in laxity and in stretch marks, shall we say, in simple terms, for sure.
Okay. And when we look more about the technical details, so how do you apply the product? How do you inject it? Is there any difference compared to?
As far as the layer we are injecting, no difference.
No difference, okay.
As far as the depth, yes, there probably will be, because we have different thicknesses of skin. You know, the thinnest is around here.
Yeah.
The thickest is going to be wherever it is in the body. And that difference is very, very big. The thinnest to the thickest is really going to be multiple times the size. And so we may see visually, when we inject and that bolus appears, we may find the bolus there on, I don't know, a leg or an arm, is looking slightly different post-injection to, say, on the eye or the face. So visually it will look different, and the bolus may change, go up or go down in different times. But in terms of the layer and our target, in terms of the cells, that's the same.
So we are still in the dermis?
We are trying to be as close as possible to mid-dermis, yes.
Mid-dermis, okay, that's very specific.
Yes. We are in Germany, a land of efficiency, why not?
So have you ever thought of using a cannula injecting the body?
I've thought about it. For about 2 seconds. The reason I don't do it is because a cannula is always going to be under the skin. You can't get a cannula in the dermis and really traumatize that as you go through. And so for me, a needle is a precision instrument that is very, very precise in the location in which you're depositing your ingredients. A cannula is not a precision instrument.
No.
A cannula is useful in specific times. But when you have to really sharp with, no pun intended, when you have to be sharp with the layer you're targeting, I think a needle is the best tool for the job, for me anyway. And if you use body in a cannula, the delivery of the ingredients, I think, are just not where they need to be. Some movement of the ingredients may occur, you may get some improvement, but I think you will get far better improvement if you are precise and accurate with the placement.
What are the main areas where you're using the product?
Me personally, abdomen is probably the most common area that I've seen. Like I said, people that have lost weight, women that have had children, they're probably the two most common areas. And typically when I treat that area, I may see stretch marks. And I will say to the patient, by the way, have you noticed you've got stretch marks? Obviously I have noticed there's stretch marks. And then I'll say, well, would you like me to treat that as well? Worst case scenario is it does nothing. Best case scenario, it actually improves the appearance of those stretch marks. And I say, yeah, sure, why not? So typically in the first session, I'll say, why don't we give it a try, free of charge. They will notice a change. And then I say, well, if you want to carry on, we can add that to the treatment, no problem at all. And they will do that as well. Then they may say, well, actually, I've got some stretch marks, I don't know, on my back or on the side of my leg or something. And then we will actually increase the size of the treatment plan because they see the positive changes that are happening.
And do you ever combine the body with other products?
Not particularly in terms of injectables. If someone's having other clinical treatment, like a laser as an example, yes I do. When something is really lax and you're talking amounts of skin that you can hold, this is not for that at all. That's a surgical intervention. And so we can try and improve the outcome of surgery with certain techniques, which, you know, if you come to the training, that's part of what we show. So we can combine it before lasers and surgery and things like that to try and improve those outcomes, definitely.
Any good results on the legs?
Yeah, I mean, I think the quality of the results are typically the same everywhere, as far as I can work out. There are times when you do have to add to the advice given to the patient. Let's say, for instance, we are treating the legs, and you are in a sunny country, so not London, where I'm from, unfortunately, you know, Spanish, Italian places, etc. When they are wearing shorts, or they're on a beach and they're wearing, you know, underwear or something like that, and you're having oxidative stress hit that skin post-treatment, you are reducing the ability of the product to do the work. And so as long as you're switched on to give that advice to the patient, and the patient is willing to listen to you and actually do what you advise, then the results can be the same as anywhere else. somewhere like here, for instance, even if it's a hot day outside, typically we've still got a t-shirt on, so it's pretty easy to not need to do it. But then when you've got shorts and it's a hot day and you're trying to treat the legs, you have to do something about that, just at least during the treatment, to try and get the result you want.
Yeah, okay. Do you see any contraindications besides saying this is not a suitable patient because it's a surgical intervention needed, but any other thing that you think?
So there are on-label indications. So, for example, anyone who is pregnant, as usual, we can't do anything about that. If someone has an active skin infection, as an example, we can't do anything about that. We can't treat them either. Any kind of skin issue, essentially, we've just got to be careful about. Now, having said that, I do still treat that in clinic. However, I'm in a unique position because part of my job is to be a consultant in biotech research. Part of my job is to do exactly that. So I'm fine, I can take that risk. But when you have an active skin condition like psoriasis, eczema, acne, you are working on off-label. And so I can't officially say anything about that, but I can say you are off-label. And it's the clinician's decision and choice as to whether they understand enough about how it works, understand the condition, and then whether they want to put those things together to go and do that. Officially, on-label, it's not covered.
Okay, I see. And how many sessions would you, let's say, recommend by default for body? Yeah,
typically 2 to 3.
2 to 3?
Yeah, if there is minor laxity and it's something which only the patient really notices, typically about 2 is what I have found, as long as you are injecting, again, in the right layer, in the right amount, etc., etc. If something needs a little bit more time, for example, post-pregnancy, that's a large area that's treated. Something like that may take 3 sessions or 4. 2 to 3 is the average. Now, if you do 3 and you get a great improvement, the patient thinks there is still room to improve more. There's no harm or problem in still doing more. You can do 4, 5, 6, 7, whatever you want. But obviously, there's going to come a time when it's just fixed the problem. So there's no point doing any more. If the patient can afford to do more, time and money, and you are happy to do more in terms of product, and go for it. 2 to 4 is probably covering 95% of patients.
I mean, body is a large area. If one area is fixed, you can go to the next one.
Exactly. 2 to 3 is average. 2 to 4 will cover pretty much most people.
Okay. And in terms of amount, I mean, we have 10 ml.
Yes.
So what is the area that I can cover with 10 ml roughly?
Sure. So if you are going to use the full 10 ml in one session, you can probably do most of the abdomen, going even onto the torso, a little bit on the side as well. Okay. So it's a very large area. If you were going to treat, let's say, just the area that someone is having lax skin in post-pregnancy, you probably won't even need that full 10 ml. You can get away with a fraction of that, and you'll have some left over for the next session.
Okay, interesting. Thank you very much.
Thank you for having me.
So, das war das Thema Sunekos Body. Wie immer, wenn ihr noch Fragen habt, freuen wir uns auf eure Kommentare unterhalb des Videos. Wir bemühen uns, die ganz, ganz schnell zu beantworten. Und ich freue mich natürlich sehr, wenn ihr bei der nächsten Folge wieder mit dabei seid. Vielen Dank.